constant. Many clinicians busy due to their busy schedule, they are unable to have time for audit. That is why in our hospital currently we are unable to do the audit regularly. It has become very irregular and time constant is one of the factors. What are the factors which promote success? Supportive organizational environment, sound leadership and direction of audit program, strategy and operational planning in audit program, resource and support for audit program, monitoring and reporting of audit activity, commitment and participation. What are the key lessons from various audits? Foster an environment for audit. Audit is a valued activity, can augment both career and professional development, provision of protective time for audit, commitment from the staff. Tackle the problems of multidisciplinary audit, can be seen as threatening, exposing one's mistake to another. This area is very important. Whenever we do audit, this is often highlighted and there is always criticism. So that part is to be tackled very carefully. Staff training in interpersonal skills and in dealing with conflict benefits outweigh disadvantages. What are the key lessons from various audits? Review of staff training program we can review, emphasize on audit facilitation, establish confidentiality of finding, ensure all relevant staff are involved, establish evaluation program. Checklist, question, criteria. Why was the audit done? Reason for choice should be clearly defined, should include potential for change. How was the audit done? Criteria choice should be relevant to the subject, should be justified based on literature surveys. Preparation and planning should show adequate teamwork and methodology in carrying out the audit. If standards are set, they should be appropriate and justified. What was found? Interpretation of the data should use all relevant data to allow appropriate conclusion to be drawn. What next? Detailed proposal for change should show explicit details of the proposed change. I have actually to simplify the matters. I have taken a case of prescription audit in a pharmacy of a tertiary care hospital. This is not our hospital. This is a model case I have taken just to very simply tell what is audit. This is a very simple form of audit, anybody can do it. Audit questions, whether name and registration written over the prescription, whether duration of drugs to be taken written, whether doses are clear, number of drugs not dispensed, number of drugs mentioned by brand name, number of drugs mentioned by generic name, number of drugs prescribed, whether department mentioned. These are some of the audit questions we take during prescription audit. Then audit answers. Very surprisingly, in 70% of cases, the clear-cut diagnosis is not written. In 71% department not written. Number of drugs per prescription or drug load per patient is 2.3. That means number of drugs prescribed divided by the number of prescription or number of patients, we get 2.32 per patient. The drug load is 2.32. Number of drugs written by generic name only 26.8%. Number of drugs written by brand name is very high, 73.2%. Number of prescriptions with name and designation not written 80.6%. Number of drugs with doses not clear 47.6%. Number of drugs with duration not written 53.6%. Number of drugs not dispensed 5.8%. So this is some of the answers to the audit questions while doing a prescription audit. Then now from this we have identified our deficiencies. Then what should be a model prescription? This is a model prescription. I understand that in a busy outdoor, sometimes we cannot write everything, but model is a model. Who can follow, they can follow.
One in a booklet form, all these are overcome actually.
This is
advantage of a booklet form.
Yes. What a prescription should constitute is all these 15 items. You see that name of the patient should be written, then date, age, sex, address, CMI number. In our hospital it is very important. Then the complete diagnosis, as in this case, test case, idiopathic Parkinson's. This is the diagnosis. Then number 8 is that recipe sign. Then what we have prescribed? We have prescribed tablet levodopa 100 mg, tablet carbidopa 25 mg. I do not know whether this is the correct treatment. This is written in the book. Clinicians can tell. But the drug is prescribed by a generic name. And the direction is in number 10. The direction is dispense 100 combination tablets. So any preparation, as since the drug is prescribed with generic name, any preparation containing this levodopa 100 mg tablet and tablet carbidopa 25 mg tablet combination tablet can be given. In our case, in our hospital, this is a problem because all VIP patients, they actually insist on the brand name. Even if the drug is available, they say that I want that drug only. Whether that drug is really effective or the name of the drug is effective or it is a placebo, I do not know, but they insist that even if the alternative drug preparation is available, the brand name particular drug is to be prescribed. Then the direction is take 2 tablets by mouth 3 times daily with breakfast, lunch and dinner, take with food. This is the clear-cut direction, no confusion, that take 2 tablets by mouth 3 times daily with breakfast, lunch and dinner, take with food. Then number 12, the name of the prescribing doctor is signature with degree, MD and his designation assistant professor of neurology, medical college, or anything like that. Then registration number, which medical council. Incidentally, this is my registration number. In practice, topics for audit need to be chosen with care. So I have given one example that what a complete prescription should be and what are the deficiencies. In practice, topic for audit need to be chosen with care and refined to make them suitable. Standard setting require clarity of thought and careful definition. Data collection to observe practice can consume endless time and money. Lasting change is notoriously difficult to achieve. Normally, we human beings, we always resist change. So, lasting change is notoriously difficult to achieve. Conclusion, notwithstanding the above, once audit is understood and planned, it is one of the best ways for monitoring the quality of care being rendered and for bringing about the requisite changes for improving care, professional development and patient and employee satisfaction. For further reading, you can go through all these resources. These are all valuable resources.